I'm sort of the host of the course. Welcome, everyone. A couple of announcements. Please sign in if you haven't. If you're a student, it's required to sign in. It's required that you be here. And if you're a community member, it still helps us justify this course. So if you wouldn't mind signing in, that'd be great. Thank you to MCAT for recording this. The lectures will be available in about a month. And it's filmed by, through their media assistance grant, and you can find more about it on MCAT.org. And if you could fill out an evaluation sheet, that would be very useful as well. I want to introduce an old colleague and crony of mine, Dr. Tom Bulger. He's been an ER doc in Missoula forever, almost forever. He and I we come from the same generation. Our kids went to kindergarten together, so known each other for a long time.
We thought we were going to be in-laws once, but
they almost got married
then when they were
in
fourth grade, they broke up.
Yeah. So he's going to talk about care, Kenya, Nairobi, nomadic.
Yeah, whatever. I'm going to talk a little bit about my own experience working in Kenya, but I'm going to try and put it a little bit in a framework of what I think the principles of global health are. Jeremy Smith was here, as I'm sure you recall, and he gave a sort of an updated perspective, which I thought was very useful. Mine is more of an older perspective in one sense, and I think I'll show you that Kenya, probably that old perspective still works pretty well, but I think what they've done is quite nice. I actually put this slide in for a class of some people who are going that way, but it does give you something to focus on. Whose lives were saved to increase life expectancy in this century? I'm going to show you what's happened to life expectancy in this century around the world, but it isn't everybody's life that really made the big difference. Three main causes of decreased death in this century, and the best predictor. What's the best predictor of premature death within a society? And that one, I think, will be a surprise to you. I'll leave that for the moment. Global health. First, it's about death. If you look at life expectancy, this is the United States life expectancy from 1901 to 2001, and you can see the life expectancy has changed dramatically. If you see, oops. They shouldn't give old people these things. You can see what has happened to life expectancy in that period. So what's that about? I mean, is it because we have hospitals on every corner, and is it because we're very wealthy? Is it because global warming? What is it about? Well, the Bible says, and before we had Jeremy's people, this was the only written thing we had. The life of our years are 70. How many is that? You people are minimally religious. A score is 20, so that's 70 years. And if by reason of strength they be 80 years, 80 years, yet is their strength labor and sorrow, for it is soon cut off and we fly away. The point being that in those days, whoever wrote this thought that life was about 70 years. But we can see, going back, that life wasn't 70 years. So where is the discrepancy, if this is indeed true? Why did life expectancy double to 70 years in the 20th century? Anybody have a guess? Well, it's kind of one of those questions, what am I thinking? If you go down to Fort Missoula and you look at the headstones and you look down and you see a lot of these, Robbie L. Wallace died, aged 11 months. Historically, and in many developing countries yet, the death rate between 0 and 5 is tremendously high, particularly between 0 and 1, but between 0 and 5. And if you look at infant mortality, it's kind of an interesting map, and you can see the places, the reddish purplish is bad, and you can see where the places are, that's Afghanistan, that are bad. The best is this color, like Australia, or like other forward-looking countries like Western Europe, or Canada, or the United States is not one of the good ones. The United States is one of the okay ones. We have this fantasy that we have the greatest medical system and care in the world, but by every measure, it's demonstrably not true. We're not doing a very good job. Despite the fact that people are going crazy and they say they want to get rid of Obamacare and so on, the way we're doing it is just not very good. But that's for another day. So, here's what life expectancy is all about. Say you have 2 children and both live to age 70, then average life expectancy is 70 years. If you have 2 children and one dies of pneumonia as an infant or diarrhea as an infant, very common ways to die in many countries, and the other lives to age 70, the average life expectancy in your family was 35. So that's how you get a life expectancy of 35, is you have children die very young. The life expectancy of a 10-year-old, if you can make it through the first years, you've always had a fair chance at a fairly long life. If you look at 1850, your life expectancy at birth was 38, okay, white male. But if you could make it to 10, then your life expectancy was 48. That'd mean plus 10, you're already 10, that'd be 58, almost 60. So if you could just get through that first 10 years, you double your life expectancy. What kills children? Well, this is a slide that show you, and I'll show you some specific to a place where I spent time in Kenya, distribution of cause of death among children less than 5 years old. And this is the traditional model, because when you look at it, this is infection, 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 and some of these other ones may be related to infection as well, secondarily. So infection is the big killer of folks. And I think we'll just skip this, but if you look at the infectious disease that people die from, the common ones, particularly in babies, but not only, let's leave AIDS out for a minute, but are pneumonia. Now, why do babies die of pneumonia? 2 reasons. One is they don't have medicine, perhaps. The medicine costs pennies. The second is they start out sickly. They don't have the normal immune system, and we'll get into that a little bit. Diarrhea disease. Every one of you, when you were a baby, you had diarrhea, but you didn't die from it. You weren't sickly in the first place. But in the second place, we had all sorts of ways to give you fluids, and if we needed to, we could give you fluids intravenously. That's all it takes is fluids. It takes nothing more. Measles, malaria, so on and so on. So who should we thank? Who did this great thing for us that doubled life expectancy? Cool doctors, right? Not really. It wasn't. The changes in life expectancy are not about the things that people, when I ask people what it is, it's not about antibiotics, it's not about miracle drugs, it's not about heart surgery, it's not even about health care per se. What it is about is 3 things. The first is sanitation, okay? Having sanitation is a huge deal. These people are living, I don't know that they get their water out of this ditch, but they're living with feces, okay? And most of those diseases that you saw, those diarrheal diseases and many of the other diseases, are from fecal material to the water, okay? So sanitation is a huge deal. The next one is about the water, is that clean water. We don't think too much about water here, but like, for instance, the people in Kenya, most of them spend many hours, where I was out in the bush, many of them spend many hours every day trying to get water, which is not clean, but just trying to get any water at all. And finally, vaccines. For instance, smallpox. because if you were a generation older, most of you folks, you would know more about smallpox because you would all have gotten a vaccination from which you get a scar. During the 20th century, which didn't end so long ago, look at how many deaths smallpox was responsible for. 80% mortality in children. Smallpox is gone. Why? Because of vaccines, despite the fact, what's the blonde girl who doesn't like vaccines, despite her expertise? Vaccines have had everything to do with increased life expectancy and less tragedy. Measles vaccines alone, you've all had that, estimated, when I was a kid we all got measles, estimated 17.1 million lives since 2000. Okay, so, and everyone benefits, yes, but it's not quite the same because it turns out everybody doesn't benefit the same. If you look at Africa, theirs is like ours, only you can see that the slope is actually going much faster. If you look back to the 60s, they're catching up in a great burst. But it turns out that many things intervened, or some things intervened, and life expectancy still really depends very much on location. Before I showed you infant mortality, this is life expectancy of all of us. And you can see a lot of the same places are bad, a lot of the same places are good, the darkest is best. This country is doing okay for a developing country, but not nearly as well as other wealthy countries. And so location is important, but there's more to it than just location. It turns out that if you look at mortality at the Titanic by passenger class, men, women, so on, the mortality was very, very high in the third class, not as high in the second, and very low in the first class. That's just a story. I mean, it's just a one-off, except that in almost every country in the world, it's exactly the same. You'll find out that social class is the greatest predictor of health. If you just take one variable, social class is the one that is most helpful, except in a very few countries like, say, Sweden. The first time this was discovered was a guy, his name I'll think of in a second, who did, because in England and Wales, because of their national health system, they're able to keep track of everybody and see how they're doing. So what they found out was that they looked at how their occupational class, which is one of the ways to determine social class, and one of the most useful one, and they found out that melding all sorts of people together, unskilled manual laborers had the least life expectancy. It went up, partially skilled, so on, managerial and professional. Social class was a huge determiner of life expectancy, and remains to this day. I put this in just because I think it's a very, very striking slide. Tuberculosis, which has killed millions and millions and millions of people going back for thousands of years, the cause of it was found by Koch in about 1880, right here, right? Oops, sorry. By 1880. But you can see that the rate of people having tuberculosis has gone down and on down and on down. A lot of diseases do that, not surprising, except there's one thing. Why did it go down? Why would you think it would go down? Just throw out a guess. Treatment, yeah, that's what I would guess. Well, the first treatment that there ever was streptomycin, introduced in 1948. It didn't have to do with treatment. It had to do with social conditions. It had to do with living conditions, how many people lived in very, very close quarters, in tenements, what the general health and hygiene of the people was, and no doubt their nutritional status was important as well. Did you ever think, most of you probably are from Montana, did you ever think as you go down the highway and it's 40 below, or it used to be 40 below, and you see all the cattle out in the field freezing their ass off, and you think, well, why don't they make them a structure? Why don't they get them in a structure? I mean, why don't they protect them a little bit? Why don't they? Huh? Disease. That's exactly right. I mean, farmers know what they're doing, right? They know how to keep their animals alive. But if you put them in close quarters, in very close quarters, you get disease. So anyway, I'm just trying, and one last slide to show that social factors mean everything. This is the life expectancy in the 70s to 2000 in the European Union. And this is Russia, which was very similar, but with the dissolution of the Soviet Union, it plummeted life expectancy for males. Life expectancy plummeted to below retirement age. Just the degree of social disorganization and dysfunction was so great that men were dying at a fantastic rate. So here's some things to think about as we go through this and as we go through Kenya as well. Sanitation, water, vaccination, nutrition, access, and let's just leave it at that. Okay, where I worked was, somebody else showed you this slide, but I love this slide because I think it gives you a sense of, somebody says, well, you've been to Africa, what's Africa like, you know? Well, you know, that's like saying, you've been to Lola, what's the United States like? It just, but if you look at Kenya here, Kenya is a country with a critical shortage of doctors. And where I worked, if you look at, here's Nairobi, the capital, here's Nanyuki. We were from Nanyuki north up to just right to, up to Lake Turkana there. And we were dealing with semi-nomadic or nomadic people. Who are they? You understand that, I think we all understand that Kenya isn't a country because these people all got together and said, let's form a country. It became a country because it was colonized. And the colonial people said, okay, the Germans said, we'll take this and you take that. It has nothing to do with the relationship between the indigenous tribes, of which, as I say, there are 40. Those are Turkana. These are Samburu. And Samburu, these are warriors, and that's who I spend most of my time with, is Samburu, who are, they're like Maasai and Samburu are part of the same tree. Their language is extremely similar. These are just some typical pictures of a young lady, Samburu lady with her baby on her back, which is everyone has. As you see, they're always walking. That lady is actually Turkana, a little bit in training. Just a little kid, that happens to be his grandmother. I'll tell you about him in a sec. But I put this kid in only because you see all the flies. He's got like 10 flies on his face. I'll tell you a little bit more about that, but it's interesting. Cute little kid, so on. That's a little 15, 16-year-old Turkana girl and her brother. I thought she was striking. This guy is one of our translators, and these are 3 warriors. Those of you who've done anthropology or some of the other social sciences know that in these societies, the passage to adulthood depends on the tribe a little bit, but the passage in adulthood in these tribes, at least, starts off with circumcision. Males are not circumcised until they become a warrior. It's a very important ceremonial and social force. Then they're a warrior for 6, 8, it depends years, when they are no longer obligated to be home at night, as it were. Their job is to protect the cows, and historically it's been to steal cows from other tribes. That was the job. That was what you did. But it's still the job to protect the cows, and then once their warriorhood is over, then they're adults, and at that time they can get married. Although you have to have cows to get married. But anyway, these are just warriors, and warriors are kind of unto themselves. So where do they live in Kenya? Well, like every city, most of you have probably been to big cities around the world, in the developing world these days. There's big, huge cities, and people go there in great gobs because it's hard going out in the country. Unfortunately, what that means is they live in places where the hygiene is worse than what they left. You know, if you're going out into the woods to defecate, that's at least some separation. If you're going to defecate here in one of these alleyways, that's no separation at all. So you can imagine that that's a health risk. Where I was, this is the way, what they lived in. These are, you'll be able to see in a minute how they're made, but these are people who move along when the grass goes bad and move on to the next place. These are made out of mud and cow dung, and that's just a typical little story. What you don't see there, well, never mind. This is a little townish like thing where they get together and trade a little bit. And that's what happens when it's time to get on the road. They just take the sticks, leave the rest, burn the place where they were, and off they go. This was a dog in our camp one day, and he was our entree to one of the houses. Those are all ticks you see on him. Every little thing you see there is a tick. And then he bit this guy, and it wasn't terrible, but could have been. That's a nurse there fixing him up. And then later on, we made a sort of a house call. And the thing to see, there's several things to see here, but one is this is a little place because they take the animals out. They have to take the animals out every day to eat. See that, what looks like a fence there? Those are, everybody lives in a place that's like this, and this is all fence, and then their houses, there might be 6 or 7 in there, or like this. And what that is, those are thorn bushes, acacia trees. And they have big, huge thorns. I'll show you a picture of it in a sec. But that's to keep the animals in at night and to keep the, hopefully keep predators out. These thorns are incredibly long. Goji kidogo, they say. Goji kidogo is Swahili for wait a little. You know, you're going out and you get caught and they say, Goji kidogo. You know, it's just a way to remind you to wait for just a second. This is inside, and this is the mother, another boy. You can kind of see where they sleep. They sleep on animal skins. These are more of the kids wondering what we're doing in our house. And the daughter who thought we were scary as hell and didn't want to come in. It's where they sleep. And that's where they cook, inside the house. Maybe we'll get back to this a little bit, but this has something to do with one of the causes of disability they have is how they cook. They're just bringing the animals in at night through the little hole in the fence there. So, how about these folks? How is their health? I wonder if I stood over here, if I'd be better off. Well, we've seen the life expectancy thing, and Kenya is the blue, so you can see they were going on gangbusters. And then, about in the 80s, they fell off the face of the earth. What's that about? War. Well, it's HIV is what it really is. Wars are some small part of it, but it's mostly about HIV. And it's devastating to these African countries. So if you look at, remember Jeremy Smith was here recently and he gave us the talk about their website that showed you all sorts of information on countries. Well, he shows you what the life expectancy in Kenya is it dipped down and now it's gone back up again, partially because of treatment, which when I was there 7 or 8 years ago was almost never available. Okay, water. What about the water? Well, only 58% have access to safe water. The rest of them do what this guy is doing, who is a translator with us. They dig a hole. I'll show you this. You'll see it better in the thing. But they dig a hole in a dry riverbed till they get down to water, and then they put it in these old oil or antifreeze or whatever the hell cans they are, and they take it back. And you might have to walk a few miles for something like that. If you look at access to improved water sources, again, it has something to do with at least social class. In Nairobi proper, it's not too bad, but in most of Kenya, it's only 50-50, and in really rural places, it's very poor. Sanitation, I forgot that this was in here, actually. These are some old ones, but these are who have improved sanitation. What does improved sanitation mean? If you dig a big hole and fill up the top and you just put 2 boards there that you can squat on, that's improved sanitation, because the next person doesn't have to walk through or touch your feces. But you can see it's, oh, there you go, enhanced sanitation. That's my New Balance shoes in Kenya. Vaccines. And we're going to skip this because this isn't this one I want. Infant nutrition. And this is a big deal. And you have no idea until you start looking into it what a big deal it is in much of the developing world. If you're poorly nutritioned, what's the word, fed, if you're poorly fed in the first few years of life, you will never recover. You'll never be the same. And your chances of dying go up astronomically. This is what the term for this is called stunting. And stunting is defined as shortness for age. Like this kid is stunted, these two are the same age. Obviously, you're looking at a whole cross-section of people, and it isn't just, you know, obviously one girl could be taller and one people another, but it's how they grow and how they don't grow. What causes stunting? What kind of nutritional difficulty do you think causes it? There's no reason you'd know, but does anybody have a guess? Huh? Protein. It has everything to do with protein. Protein, which we get tons of, is hard to come by in most of these countries. And if you don't get it, and about 3 years old is kind of the cutoff, you can catch up sometimes if you can get it. Say you didn't get it for the first year of life, you can sometimes catch up. But after about 3, you never really catch up. This is. I am pointing it. Oh, maybe I'm pushing the wrong thing, am I? Oh, maybe that's it. Am I going the wrong way now or what? Oh, I think I'm pushing the wrong thing, that's why. Okay. This shows the stunting. I think I was pushing the wrong way. And just to show you some of the effects of stunting, I'll show you something that I think is flabbergasting. This is just birth weight. This is poor nutrition before you die. Okay, risk of diabetes in men aged 64 years, this is in England, by birth weight. Well, it turns out if your birth weight is small, it's probably because the nutrition that the mother had during the pregnancy wasn't good. That's the biggest cause. There are other causes, smoking, so on. But these ones who are very small, their risk at age 64 of diabetes, that seems like crazy. Why would those two be associated? But they are. The repercussions of poor diet in childhood are lifelong. We'll skip that, except to say that this is South Africa. And out where I worked in the bush, everybody was thin. And when you saw a fat person, you knew they were from Nairobi, that somebody had come up from Nairobi, and you'd see a big Land Rover that they'd travel in. But there were no fat people out where I was. This was where we would go. This was probably 2/3 of it. We'd go to little places around. These people are not nomadic, and a lot of other people are. These are maybe semi-nomadic. And we'd go out and drive out to their place. The other way we'd get there is via camel. And you'd walk up the riverbeds, which were dry, except during the rainy season. And they use those as beasts of burden, rather than you didn't ride the camels, though it's possible to do. So what did we do? We did immunizations, we did family planning, birth control, pregnancy support, which was a big deal. Vitamins that have a great deal to affect about some birth defects. Tetanus, I think I'm going to get to tetanus in a little bit, but tetanus, as you may know, the way most people die of tetanus these days is that it's from the umbilical cord. Tetanus is a bug that's everywhere on the ground, and If you get it on the umbilical cord in a baby, you don't have any antibodies. You don't have any way to fight. What it does, it sends out a toxin that will paralyze you. So the baby has no defense. So if he gets it, he'll die. But if you give tetanus to the mother and stimulate that, she'll have antibodies that she'll pass to the kid in the milk. So you can decrease that tremendously. Pregnancy support, malaria, I think we get to this, but one of the biggest risk factors for malaria is being pregnant. HIV counseling, tendon, condoms, and what they call curative, which just means I got a headache, I got a sore throat, I got diarrhea, which some of those things, if you're nauseated and have a headache and fever, you probably have malaria. This would be a typical place where we would set up, run a TV off the generator of the battery. This would be some HIV education. Then these are that's BCG, which is a tuberculosis vaccine we don't get in the States. These are all pregnant women getting their treatment from this lady who is sort of one of my heroes. She's a nurse, but in that field, there's no doctors out there. It's nurses, and they operate as doctors, and she was fabulous. She was as good as any doctor, any place. Just more vaccines. I put this in just because she brought the kid in, not for anything special. I forget why she came, but you see the pus in his eyes? Well, conjunctivitis is very, very common there because flies are very common, because animals are very, very common there. And we'll get to that too. This is pregnancy. I remember this. This was a Maasai girl, 16, pregnant for the first time. And that would be a typical deal before we start the clinic under the tree. You'd stop someplace under a tree. People would come and they'd get some HIV education, and then they'd come to the clinic. Kids loved the movies, and they were very well done. It was all musical and so on. So kids were pretty well informed about HIV. This is another nurse taking care of some of the pregnant people. Box of medicines. This is the guy who brought us our camels. He wrote them. We didn't, except for pictures, but they're great beasts of burden. And this is us walking down the Lugga, it's called. This will show you where the water comes from. This is us just coming on the dry riverbed, and this is where they dig down to get the water, and that's the water we were drinking every day. That's the only water there is. Now, we drank it in tea. That's how we drank it, so it's boiled, but you know, you can see it doesn't look terribly good. Then you put the thorn bushes around it to hopefully keep the animals out. But it's a big deal. People often have to walk several hours a day just to go get water. This is one of the translators doing it for us, and that's our tea water. I never got sick from that, at least. That's what we ate, which is mostly a little cabbage. I think we got a tomato that day, and that's ugali, which is a cornmeal. Many of these tribes, what they eat mostly is milk from the animals and blood from the animals. They bleed the animals and drink the blood. And for feasts and things, they drink the meat, eat the meat, but they don't get much else. Just another little girl. This is doing HIV testing on one of the Morans, one of the warriors. As you'll see, he's very young. They don't put this is just an aside, but they don't have everybody becoming a warrior when they're 13. They have what they call an age set, and they do it maybe every 3, 4, 5 years. So some will be 13 and some will be 18 as we go in. So you put a little drop of his blood on it, and up there, and then you wait. This is a control, which just means that the thing works. Did I miss one? No, I guess not. Again, giving him some condoms. I put this in because it's interesting. Everybody has, if you've been to any third world place in the last, everybody has a cell phone now in almost every place, including us. We were miles and miles from any place. And they were using this backpack, which is solar powered, to charge it. The reason we had that was most of the vaccines, or half the vaccines you give are cold sensitive. They have to be kept very cold. And there's a little indicator on the package, and they go bad. At least half of ours would go bad every time. So we're trying to figure out a way to, once you get further out in the country, to keep the vaccines cold, to try and run refrigeration off solar power. So, some diseases. This is some of the things that we saw. This lady had what looked to be an infection in her knee, but the interesting thing about it is, can you see that little mark there? There, and then there's some here. One of the things that, this is I'm not sure what the right word is, but this is a cultural belief that certain diseases should be treated by cutting with a knife, and that's what's happened there. I don't know whether she had a bad knee and cut it, or she cut it and then, because she had some pain and then it got infected. I don't know for sure, but anyway, it's pretty common. There you can see the things right there. This lady, I like this because she was such a nice looking lady and so on. She's a Turkana lady in a little school, but she's HIV positive. In those days, as I say, which was 7 or 8 years ago, she lived 20 miles from the only place where she could possibly have got primitive antiretroviral therapy. But she might as well have lived on the moon. I have no doubt that she's not living anymore, because it was impossible for her to get there once a month. The price alone of getting on a little what do you call it, matatu, little, like a little Ford Econoline van with chairs in it and so on, to go there once a month. It just was out of the question. This little kid, I don't know if you can see, but he's got, maybe you can see the snot here. But what you can't see is how thin his arms are. I don't know if you've ever seen that Doctors Without Borders has a little sliding deal that they make where you can put it on the forearm of a kid and tell what their nutritional status is. I should have brought it in, but this kid was wasted to beat hell. And well, what's the story? Well, that's his grandmother, and she can't breastfeed him. There isn't enough there isn't enough food, and his mother died of AIDS. So this kid may well have AIDS, because many kids get it in childbirth, and a few get it a few get it from nursing. But it's another story of the devastation of AIDS. This was a little clinic we had to bring some treatment, not antiretrovirals, but some treatment. There are other treatments that help minimize some of the symptoms. About 5 miles outside of a city that we used to go back to, had about 5,000 people, where there was some treatment. Most of these people are HIV positive. That little kid's mother died of AIDS, but I don't know that he has it. This is a little girl who had an infection in her wrist, which is something that you don't see very often. In this country, if you saw somebody who had a wrist infection, you would think that what they might have would be gonorrhea, which then can go to secondary sites like the wrist. We treated her with antibiotics. She got better, but of course, I don't know for sure what she had. This is something called Madura foot. And what that is a fungal disease of the feet, so that if you look at these little things, that oozes little fungal material, but it's chronic, going on for many years. At this stage, there's no treatment other than amputation. This is a little kid who, I don't know what he had, but the thing that it fit the pattern for best was probably polio. He developed some limb pains, body pains, and then developed some paralysis. It started in his arms, went to his legs, and was fairly profound at this point. They recommend treatment diagnosis be made for polio in Kenya by taking stool from the patient freezing it and transporting it to Nairobi, which again might be saying, put it in a rocket and send it to Mars for your ability to do that, which is trivial. And this was about a week later, and he was much better, but he still had a lot of weakness, which typically was what happened when I was a kid and polio was in the land. A lot of the people who got at least partially paralyzed improved. That was a little talisman he had on his back to ward off evil spirits. This kid, and this is him too, he had nothing except a very easily treated seizure disorder. But the problem was the treatment. It was very, very difficult for him to get the drugs. We'd give him some when we were through, but we'd have like a month's worth, and maybe we wouldn't see him the next time. And he just has these uncontrolled seizures and beats the hell out of himself. This little girl was a pistol. She hung out with us for some time. Maybe we're not very good clinicians, but she hung out with us for some time before we realized that she was deaf. She's very smart, and she has two interesting things about her. One is that she's deaf, and you know when you take like an old picture, you don't get them as much anymore, but you take a picture of somebody and you get that big red eye? You know what I'm talking about? Well, what that is the flash is going back to your retina, which is all red. If you look in there with a scope, which is all red, and it comes back, flashes back at you. Well, this girl, it doesn't happen that way, and you can't see it very well probably, but hers are very, very cloudy. That's her lenses, and what she's got is cataracts, congenital cataracts. If you were to, what happened to her, I can't tell you for sure, but what I would say is that her mother probably had German measles. What do you call it? What do you call it? Rubella. Had rubella while she was pregnant with her, but you don't get that anymore because everybody had the stuff. I told you about the flies on this kid. And here's another kid. You can see there's a fly supping at the pus right up here. And the pus in his nose and so on. Well, that brings up this old guy. As you can see, not surprising looking at this picture, that he's blind. You can't see a thing, right? And you can see, look at what his eyes look like. And if you look sideways, you see why. You can see that it's just, this is creamy, milky, you could barely see light through it. But if you look sideways, do this. Oops. Come on. Do this. Take your finger and feel your top lid in between your fingers. And right at the margin, you feel something called the tarsal plate, okay? That's cartilage that takes the margin of the eye, and there's one on the bottom as well. Well, this guy, because he had that chronic conjunctivitis, right, what happens is it scars that tarsal plate. You have so much inflammation and so much infection there, it scars that tarsal plate. It turns under, and now you can't see any lashes here because they're all turned in, scraping and beating the hell out of his eye. And that's why he's blind, for want of 10-cent medicine. This guy, you know, I don't know, maybe if it comes through this picture, but by his features and by his size, you would think that he probably has a pituitary tumor which secreted human growth hormone. So he's like Andre the Giant. He's a huge, huge guy. It's a bad deal, but also they have other medical problems, heart-related problems and so on, that there's really no feasible way that this guy living out in the bush is going to get taken care of. Gives you just another view of him. How his features are. Oops. This kid had a congenital heart disease, which we just found, but I don't know exactly what it is, probably a VSD, but he had a big, loud murmur. Him we sent off to Nairobi to try and get some care, but it's not that simple, you know, because to send him to care in Nairobi, you have to, A, pay his way, B, pay his family's way, C, put them up in a place. If he goes in the hospital, he'll still need money if he wants tests. He has to pay for the tests, for food in the hospital. So it's a very big undertaking. It's not just a simple referral. This young lady I put up, you can see the flies on her mouth there. And you can't really see it here, but she has some of those little cuts. She was quite sick with malaria. She is actually not the same person, but it reminds me of another girl who came down, and she married a guy down by where we were working, but she lived, say we were here, right? And here's sea level here. She lived up in the mountains all her life, and then she came down and married this guy, and she got extremely sick. Why is that? From malaria. Why is that? Huh? There's no malaria up here, no mosquitoes, no malaria. It's too cold, right? And malaria is a funny disease. You never get totally immune to malaria, but that's why when you look at see who dies of malaria, it's young children first, because they get it, and let's say this is immunity in time, and if you survive, you get a little bit of immunity, very partial. If you survive again, you have a little more, and so on. So by the time you're 5, you have pretty good partial immunity, okay? This girl had never had malaria, so she was like a baby at high risk for bad complications. Just to put it, the other case is a pregnant woman, okay? So she's up here, she's doing well, and there's something about pregnancy which decreases your immunity. We know that in all sorts of other facts. It's often explained as you have this foreign body growing in you, so your immune system has to be less robust. But anyway. Bed nets. That was one of the things we did. There's a bed net there. But I show you the picture just because historically they always had spears and a shield. And the English took away their spears before when they were colonized, and unfortunately now they all have rifles. These are illegal, but pretty common in these parts, particularly the farther you get north. That's an AK-47, I'm told by somebody who knows about guns. You can see these children were thrilled to see me. Okay, this isn't quite up to date, how many people have HIV and so on and so on. But one point I want to make here, is that 2/3 of the adults with HIV positive are women. Girls 15 to 19 have rates 6 times higher than boys same age, despite less sexual activity. Why is that? Well, they don't call it rape, but rape is part of it. Or let's just put it as there's a great. It isn't rape exactly as we know it, but there's a great power differential between little girls, or young girls, and the men who have power. It isn't the warriors. It's the older people who have a lot of cows, and so it's difficult for women. But the other important thing about HIV is this. If you have sexual intercourse, right, and you have a penis, or you have a vagina, right? The HIV is in your secretions. Well, this guy leaves his secretions and leaves, and he has a momentary contact, 5 minutes, 10 minutes, depending how good he is. He has very short time with her secretions, right? This lady, however, not only does she have his secretions for a longer period of time, might be for hours or a day, but there are often microabrasions here during intercourse that break down the skin defense, the mucosal defense, so that in every encounter, it's better to be, as they say, a pitcher, not a catcher. If you look at if you look at the risk for any given sexual act, the highest risk by far is homosexual men, anal intercourse, the receptive partner, because they get all this. They get the abrasions, they get hours of the HIV on the mucosa. But so girls are in kind of a tougher shape, despite the fact that they have less sexual encounters. I've lost my deal. Okay. Pregnancy. Remember I showed you that slide out in the fort of the little 9-month-old baby that was dead? Well, if you ever read anything like Guthrie, The Way West or something, every wagon train is stopped by some lady who dies in childbirth. That is the way of the world. That's the way it has always been up until the last 75 years or so. And in women dying in pregnancy or other complications of pregnancy is still very, very common there. Immunizations, that's what we gave. Also, you give all the women malaria medicine prophylactically because they are at greater risk as well. Let's leave this. So how do you prevent the children prevent it in children? You prevent it in the mothers, okay? So you teach them to know their status so they know when they're at risk. So they know what the risks are, and so their partners know their status too. Safe sex, ARVs in the last trimester. They don't do it just like this anymore. But the other thing they do is they have them breastfeed only for 3 months, because once you start getting food in there, then you get more intestinal discomfort, which is another barrier that keeps HIV out. I will leave that. These are, the last thing I want to talk about, in this, at least I got one other thing, but is schooling. What of education? We know that if you look at life expectancy in the United States by social class, I told you how much better it is, higher social class. Well, one of those determinants of social class is education. A college education is worth about 5 years in life expectancy in the United States. Education is an important part of self-protection and taking care of yourself. Education is a big problem with these people. This was a school we spent a little time at, but it's a boarding school because these people are nomadic. They'll sing here actually if you want, I guess. But anyway, because these people are nomadic, they don't want to send their boys to school because they have to leave them at the school and they can't travel with them, and they need them to work. They need them to help look after the animals and so on. The girls, they don't want to go for 2 reasons for education, because for every work that a male does, females do about 12 times as much work in the parts of Africa that I've seen. I mean, Kenyan men don't do a goddamn thing as near as I can tell. And the other thing is that these girls, like this is a friend of mine as a nurse, she was first engaged, booked they call it, at age 12. So if the father thinks, not that she would get married then, but it was promised, not that, oh, she's just going to go and be a housewife and look after some guy with a lot of cows, he thinks it's a bad investment. The only reason she got it is her older brother stood up for her and he said, I'll pay, and so she did. So there's cost, they have to pay. In addition, just mention that it's a very, it's not a meritocracy there. If you want to get ahead, there's 2 ways to get ahead. You pay a bribe. Say you wanted to go to medical school. If you were the smartest kid who ever came out of there, it doesn't matter. You have to pay a bribe, or you have what they call a tall friend. Somebody has to know you. You have to have somebody in impetus for you. And then if you get educated, it's pretty hard to come home again. So, and this is election season. I was not a big fan of this gentleman, but Nancy could tell you more about this. But he did some pretty great things for Africa. He gave $15 billion initially, I think, for PEPFAR, the president's such and such, given money. And that coupled with people on the ground, like Doctors Without Borders, the Clinton Foundation, the Gates Foundation, people doing what Nancy did, were able to get the number of people they were able to get in treatment has gone up dramatically, and life expectancy, at least in parts of the countries, has improved considerably. They say, well, it costs a lot of money. Well, this just shows you what the cost of wars are. Just the Iraq thing alone, they figure it'll cost about $2 trillion while we're done. And That's worth 15, 20 billion dollars. In other words, it's like 5% of just to pay for keeping all these people alive in Africa. So whose lives were saved to increase life expectancy in this century? Children, right? Mostly. 3 main causes of decreased death: vaccines, cleaner water, sanitation. Best predictor of premature death: social class. Here's how Kenya's doing today. And I put this up because when Jeremy Smith was talking, he was talking about a newer way to think about these things, but he's talking about the so-called demographic transition when societies don't have all this infant mortality. And what happens? People always complain that they got 6 kids, 8 kids, 9 kids. My parents had 7. But what happens is the birth rate goes down dramatically because people don't need 7 kids if they're going to live. Probability of dying between 15 and 60. This is more what Jeremy was talking about. And you can see it's 299 per 1,000 for males. Well, if you look at the United States, it's about half, roughly half that when you look at both of that. So they still have other deaths, but a lot of that is HIV. It's also car accidents and so on like this. Last few slides. This is the website of the folks in Seattle that he was talking about. Leading cause of years lost to premature death in 1990 versus 2013. Some are still the same, like what kills the babies: lower respiratory infections and diarrheal diseases. One has gone way the hell up. HIV has gone way the hell up. Tuberculosis has gone up. Why would tuberculosis go up? It's a trick question. You wouldn't necessarily know that, except that in Africa, your risk of having active tuberculosis if you have HIV is extremely high. It's extremely high. Not so here, but extremely high. But you can see, nonetheless, even though this is just rating them by numbers, most of these are much improved. They're actually much less, even though their order may still be high. Burden of disease attributable to leading risk factors. Nutrition, number 1. Nutrition. I mean, we don't even think about that. Safe sex. People are going to have sex. Unsafe water. Air pollution. How would they get air pollution? Wood fires. Big deal. Big deal in the third world is wood fires inside your home. So on and so on. But you can see that some of the things that Jeremy was talking about are sneaking up there now. High blood pressure, dietary risks, high fasting glucose. Those are the new things once you get rid of some of the infectious disease. That looks remarkably similar. And this is the last slide I want to show you. Because this, they call it, it's sort of like the years of disability, years in less than ideal health. And look what their ranking is. What are the biggest deals? Okay, it isn't HIV, AIDS, it's depressive disorders. It's low back and neck pain. Okay, this would be not being able to see or able to hear, skin disease, anxiety disorders. It's the same things that we have here, is that their quality of life has everything to do not just with dying, but if you're alive, things that seem the same thing we have. Now, we may not be good at treating depression in this country, but there's no treatment there. There's none, 0. I was in Honduras a month ago, and to write a prescription for an antidepressant, not to say that's the be-all and the end-all of treatment, you have to have a special stamp or the pharmacy won't even fill it. These things are as bad in those societies as they are in ours, but at least our society recognizes them and people can talk about them and maybe try and get some treatment, and that really isn't true in Kenya or in a lot of other places. Enough. So, going on and on, but any questions, comments? some of you have spent times in other countries, and I don't know if this is similar to your reactions or different to what you saw.
I appreciate your making note of AIDS, and it's been an amazing, I mean, there's a huge way to go, and I would say only half the battle has been done. But nowadays they put all HIV positive pregnant women on ARVs for the rest of their life. And I think it's in the range of 40 or 50 million people on HIV treatment. So in the places you took your trucks out in the bush, they now would be taking ARVs and a bunch of point-of-care technology to treat all those people.
Yeah.
They still wouldn't take, they would take birth control and vaccines as well.
Yeah, this was pre-single pill, you know, so you had to, it was a combination of medicines, and it was thought that you had to get all these blood tests every month and so on, but.
They've simplified the treatment that it is.
Yeah.
It's clear from your presentation that public health measures, water, sanitation, and so on, are probably the greatest way that we can increase the health of the general population. How much effort are these third world countries putting into public health efforts?
Well, I tell you my own impression, and this was a while ago, and this is my impression, but remember I showed you where Nairobi was, down there in the bottom? The people in Nairobi don't give a good goddamn about the people up north. They don't care. They don't care. They don't, when there's elections, they don't go there. The medicines that do get to the public health facilities are always less than they should be. For us to get medicines, one of the nurses had to go over and sweet talk a pharmacist and try and get some stuff. The simple things they can do, they haven't done. Now maybe in Nairobi, I think they probably have done it, or around places like that, but I don't think they've done much. I could be wrong. I haven't been there in quite a while, but it's a very, that's a social class thing too. You know, as rural people don't count much in Kenya. Yes, Peter.
How did you feel after you finished your tour there about what you were able to accomplish, what your frustrations were, and what did you bring back?
Yeah, well, that's a good question. And the truth is that these people I liked very much, and it was nice because it was all, I mean, it was an unbelievable experience for me because it was me and 6 or 8 black Kenyans. So it wasn't 10 Americans spending all our time with other Americans. So, and we were camping out most of the time, so got to see it. And they were very appreciative of my efforts. But the truth was that they knew a lot that I didn't know, and I knew very, very little that they didn't know. Really, they didn't need me. I mean, it was more, so I was more the beneficiary. That's often the case in things. It's not the case with more organized organizations, or with Doctors Without Borders, or people who respond to a specific thing, but so that's what I got. Did I change their lives? Not at all. But I got that experience, and I learned some things, and I learned that, as I learned in Honduras, is that people in these places are every bit as happy, if not more happy, than we are. But I believe that if you want to make changes, you have to be people like Nancy, who are organizationally involved. I mean, I'm a widget at a time guy. I'm a see the next patient. But the people who make the big differences are the Paul Farmers of the world, who organize things that show people that they can do things everybody said they couldn't. Yes?
Is there more education towards circumcision on the continent, given its relation to higher transmission of HIV?
Yeah, it's interesting. Kenya is a country where it depends upon your tribe. For instance, it's very big in Maasai, Samburu, some of the Kikuyu, which are one of the most powerful tribes, and farther south around Nairobi, don't practice circumcision. But now there are people getting elective circumcisions because it's shown because it's shown that it decreases, okay, I did this, but let's make it like this. Okay, you got a foreskin going up there, and so you have a place to stick secretions that you'll be exposed to over a day or something like that too. So it turns out that you can decrease HIV transmission for vaginal intercourse for the male about 50% by circumcision. Nancy might know more about what's happening these days on that than I do.
There is a, U.S. government is paying for a lot of circumcision. It's got a lot of challenges, cultural challenges. It's, so it'll be a while before there's enough circumcision, I think, to make a huge difference.
When I was in Kenya, a kid got kicked out of a boarding school because he wasn't circumcised. The headmaster thought that was absurd. That was a scandal. I mean, you know,
Yeah.
it's just crazy, just insane. Yeah.
I kind of have a second question there. I know that there may be some trials in Africa, but you know about the infant vaccine for malaria and for young children. Is there any ongoing effort to?
Well, there's a lot of ongoing effort, but it's well to remember what you're dealing with. You know, it just seemed, how did we eradicate other diseases? We eradicated them by vaccines, you know. Well, the problem with that is if you look at almost all of our vaccines are related to viruses, not all, but almost all of them. If you look at, say, measles, okay? Measles has 9 genes. I made that number up. It might be 11, it might be, I don't know what the hell it is. But measles has 9 genes, okay? Humans, anybody know how many genes humans have? About 25,000, maybe close to 30,000. I used to think it was more. Well, if you look at the malaria parasite, it's got 5,000. It is even though it's a single-celled organism, it's a complex baby, and it's pretty good at responding to insults like treatment. And so, you know, we've been pretty good at really simple things, not all viruses, not HIV, for instance, but it's been very hard to get vaccines that maybe you probably know more about the vaccines than I do, but there's a lot of different ways to do it. You know, some they irradiate the mosquitoes and then they pull them apart and put them in a vaccine. Some they, actually I can't remember all the ways they do it, but they've had a few very minor successes, is my best understanding, of partial immunity that lasts for a relatively short time. But I wouldn't say they wouldn't get there. Do you know more about it than that?
I know that I've heard numbers as low as 40%.
Or less, I think. Yeah.
But I don't know much about.
Nancy probably knows. No?
Nothing's been scaled up.
Yeah. No, it's all just little trials. Anything else? Anybody else want to comment? I know some of you have spent times and. Okay. Well, thanks.
Thank you all. Next week, Dr. Nerza Kern will be speaking on health disparities in Southwest USA. Thank you all.